All right, guys, this is Chapter 5, Medical Terminology. This is a very important chapter, and I cannot stress this enough. So the things that you learn in this chapter are going to be a huge foundation for you to stand on for the rest of your medical career. You're going to learn things here that help you understand medical things that you're looking at, talking about, or reading about. And I cannot stress it enough. Learn this now. Put your heart and soul into learning specifically this chapter because it is going to help you tremendously from here to the end of your career. Okay. Your National EMS Education Standard Competencies, medical terminology. It uses foundational, anatomical, and medical terms and abbreviations in written and oral communication with colleagues and other healthcare professionals. As an EMT, you must have a strong working knowledge of medical terminology. For effective communication and documentation, you must understand key terms, acronyms, symbols, and abbreviations. You can determine the meaning of an unknown word by understanding how the terms are formed and learning the definitions for parts of a medical term. Understanding medical jargon will help you communicate effectively with other members of the EMS, healthcare, and public safety teams. Anatomy of a medical term. Medical terms are made of distinct parts that perform specific functions. Changing or deleting any of those parts can significantly change the function or the meaning of a word. Components that comprise medical terms include the word root. This is the foundation of the word. The prefix is what occurs before the word root. Suffix is what occurs after the word root. And combining vowels are vowels that join one or more word roots to other components of a term. How the parts of a term are combined determines its meaning. Accurate spelling is essential in medical terminology. Here's an example. The suffix phasia with an S. I'm trying to draw while I'm. Phasia with an S means speaking. Phasia with a G means eating or swallowing. The prefix dys, dys, means difficult or painful. Dysphagia means difficulty speaking. So here you have the combination of the words. You have dys, that means difficulty, phasia, which means speaking, difficulty speaking. Okay. The next one, dysphagia. Dys is difficulty, phasia is eating or swallowing. It means difficulty eating or swallowing. Okay. Okay. So the terms ileum and ileum. This is where I need my mouse, but I don't have it, so bear with me. I'm going to try to do this with my pad. So, y'all, this is horrible. This is like kindergarten riding, but bear with me. Ileum with an I and ileum with an E, okay? This is horrible. Okay, but you see what I mean. Okay, so ileum with an I and ileum with an E, they are pronounced exactly the same, but they refer to different anatomical parts. All right, knowing anatomy and the context of how these words are used can help you correctly determine and spell the term in a given situation. Word roots. So this is the main part or stem of a word. It is called the word root or root word. It conveys the essential meaning of the word, and it frequently indicates a body part. Most terms have at least one word root, and some may have more than one root. Adding a prefix or suffix to the word root creates a term. Changing the prefix or suffix will change the meaning of the term. So, cardiopulmonary, this breaks down into cardio is a word root meaning heart. Pulmon is a word root meaning lungs. By performing CPR, you introduce air into the lungs and circulate blood by compressing the heart. Some word roots may also be used as prefixes or suffixes for other terms. A prefix is the part of a term that appears at the beginning of the word. Prefixes usually describe location or intensity. Prefixes are found in the general language, such as autopilot, submarine, tricycle, as well as in medical and scientific terminology. Not all medical terms have prefixes. All right, so the prefix gives the word root its meaning. So for the word roots, pnea, you barely hear that P right there. Anyway, you can add the following prefixes. A, which means without, Brady, which means slow, or tacky, which means rapid. Okay? This creates three very different terms. By learning the commonly used medical prefixes, you can figure out the meaning of the terms that may not be immediately familiar to you. Suffixes. These are placed at the end of the words. They usually indicate a procedure, condition, disease, or part of speech. A commonly used suffix is itis, which means inflammation. When paired with the word root arthro, meaning joint, the resulting word is arthritis, which means an inflammation of the joints. Combining vowels. A combining vowel is the part of a term that connects a word root to a suffix or other word root. In most cases, it is an O. However, it may also be an I or an E. And these are used when joining a suffix that begins with a consonant or when joining another word root. For example, gastroenterology. You have gastro, which ends in an O, entero, which ends in an O, and then logy. This is broken down to mean stomach. Use my little, I like to draw, y'all. Stomach, then entero is intestines, and logy is the study of. So gastroenterology is the study of stomach and intestines. The combining vowel helps ease the pronunciation of the term. Sometimes these words are just hard, y'all. So the combining form is a combining vowel shown with the word root. Some common combining forms are, so you have the root and then the last vowel, and all of these here are O's. So cardio is heart, gastro, stomach, hepato is liver, arthro is joint, osteo is bone, and pulmono is lungs. Summary of rules. Word building rules. When building or taking apart a medical term, it is helpful to understand some basic rules. The following summarizes the rules covered thus far. Okay. The prefix is always at the beginning of a term. That's where you get the pre from, the beginning of the term. However, not all terms will have a prefix. The suffix is always at the end of the term. Use combining vowels when a suffix begins with a consonant to make the pronunciation easier, or a term has more than one word root. A combining vowel must be placed between the two word roots, even if the second root begins with a vowel. Plural endings. To change a term from singular to plural form, certain rules apply. Sometimes you can simply add an S. Lung becomes lungs, but some rules are more complicated. Rules you may encounter when converting from singular to plural terms are singular words that end in A change to AE when plural. For example, vertebra becomes vertebrae. Singular words that end in IS change to ES when plural. Example, diagnosis becomes diagnoses. Singular words that end in EX or IX change to ICES, ICES, such as apex becomes apices. Singular words that end in ON or UM change to A. Examples are ganglion becomes ganglia and ovum becomes ova. Singular words that end in US change to I. An example of this is bronchus to bronchi. Special word parts. Prefixes can be used to indicate numbers, colors, positions, and directions. For numbers, special prefixes are used to indicate if a term involves a number such as half, one, or two, or more parts or sides. Examples are uni, dipla, null, primi, multi, and bi. Color. Several word roots are used to describe color. Examples are cyno, leuco, erythro, cero, and melano. Positions and directions. Prefixes can also be used to describe a position, direction, or location. Excuse me. Examples are ab, ad, D, circum, peri, trans, epi, and supra. Directional terms. Common direction, movement, and position terms. You have directional. You need to know the correct directional terms to discuss where an injury is located and how pain radiates in the body. Some directional terms include right and left. Those are obvious. Superior and inferior. So superior is going towards the top. Okay. Inferior is going towards the bottom. Above and below top stuff. Lateral and medial. So lateral is going towards the outside and medial is going towards the middle. This makes sense to you? Okay. Proximal and distal. Proximal is going to be closer to, distal is going to be further away. Superficial and deep. Okay, so superficial is going to be towards the top, like layer wise. Deep is going to be obviously deep down in the layers. Ventral and dorsal, that is going to be talking about the front and the back. Palmar and plantar is going to be talking about surfaces of the palms and the soles of the feet. And apex is going to be referring to points. The terms right and left refer to the patient's right and left, not your right and left, okay? Make sure you understand that. All right, superior and inferior. The superior part of any body part is the portion nearer to the head from a specific reference point. The part nearer to the feet is the inferior portion. These terms are also used to describe the relationship of one structure to another. So an example of this is the knee is superior to the foot and inferior to the pelvis. Lateral and medial. Parts of the body that lie farther from the midline are called lateral or outer structures. In general terms, lateral means side. The parts that lie closer to the midline are called medial or inner structures. An example of this is a patient has a 5 centimeter laceration on the medial aspect of the thigh. This means on the inside of the thigh. Proximal and distal. The terms proximal and distal are used to describe the relationship of any two structures on an extremity. Proximal describes structures that are closer to the trunk. Distal describes structures that are farther from the trunk or nearer to the free end of the extremity. All right, so the elbow is distal to the shoulder and proximal to the wrist and hand. Superficial and deep. Superficial means closer to or on the skin. Deep means farther inside the body or tissue and away from the skin. So an example of this is a superficial burn. It involves only the top layer of the skin, similar to a sunburn, whereas a deep laceration involves a cut deeper into the tissue, such as when someone's stabbed with a knife. Ventral and dorsal. This refers to the belly side of the body or the anterior surface of the body. Okay, that's the front. Dorsal refers to the spinal side of the body or the posterior surface of the body. This is the back. So a good example of that is the dorsal fin of a dolphin. If you can relate and remember that. The dorsal fin is on the back of the dolphin. More commonly used terms are anterior or front surface of the body and posterior, which is the back surface of the body. Palmar and plantar. The front region of the hand is referred to as the palm or the palmar surface. The bottom of the foot, the sole of the foot, is referred to as the plantar surface. And apex, or the plural apices, are the tips of a structure. An example is the apex of the heart, that is the bottom inferior portion of the ventricles in the left side of the chest. Okay. Movement terms, all right? These terms all relate to movement. You have flexion, which is the bending of a joint. Extension is the straightening of a joint. Adduction is the motion towards the midline, and abduction is the motion away from the midline. So a little trick to remember these. I know all y'all know how to flex, okay? And then the opposite of that is straightening it out, so that's the extension. So these two here, okay? These two here, let me just erase that because that one was a little out of control. Alright, so you have adduction, ADD, and abduction. All right. So if you do this while I'm saying this to you, hold your arm straight out from your body, like arms up at the side of your body. Okay. So if you move that arm towards your body and put it back down to your side, that is a movement of adduction. You are adding your arm to your body. All right. Abduction. So if you take your arm from your side and pull it back out straight beside you, like your arms in the air like an airplane, all right, you're moving your arm away from the midline of your body. So you are having an abduction movement there. Okay. An easy way to remember that is when someone is abducted, when they're kidnapped, they are taken away. All right. Same thing as the motion. When you're pulling your arm away from your body, that is abduction. When you are putting it back to your body, you are adding it to your body. That is adduction. All right. Makes sense? And yes, I'm actually sitting here while I'm talking on my computer, flapping my arms while I'm telling you to do this. All right. Other directional terms. A body part that appears on both sides of the midline is bilateral. Okay? You have bilateral eyes, ears, hands, feet. Structures inside the body also appear on both sides of the midline. Examples of these are lungs, kidneys. Something that appears on only one side of the body is said to occur unilaterally. So bi, here you have again these prefixes. Bi, that indicates a number. Two, uni, indicates one. Okay, so bilateral, both sides of the body. Unilateral, one side of the body. An example is unilateral chest expansion, means that only one lung is expanding with inhalation, such as when you have like a pneumothorax. All right, the abdominal cavity is divided into 4 equal quadrants. As an EMT, you should be able to describe the exact location of areas of the abdomen. All right, 4 equal quadrants. You have right upper quadrant. This is written sometimes as, ooh, that's big. Hold on, let me change that. I really have to, don't look at that. Don't look at any of that. Okay. I've got to get my mouse. All right. Okay, let's try to do this a little better. Okay. R U Q. Ta-da. Okay. Left upper quadrant. L U Q. Right lower quadrant. R L Q. And left lower quadrant. L L Q. And I know this looks like a kindergartner, y'all, but you know, we're working what we got. All right, again, right and left refer to the patient's right and left, not your right and left. All right. It is important to learn all of these terms and concepts so you can describe the location of any injury or assessment findings. Use the terms properly so that any other medical personnel who care for the patient will know immediately where to look and what to expect. Anatomic positions. There are many terms used to describe the position of the patient on your arrival or during transport to the emergency department. Prone or supine. Fowler's position. Those are examples. So the body is in the prone position when lying face down. The body is in the supine position when lying face up. The Fowler's position is a semi-reclining position with the head elevated to help the patient breathe easier and to control the airway. A patient who is sitting upright is said to be in the Fowler position. Semi-Fowler position, the patient sits with the back of the stretcher at a 45-degree angle. High Fowler position means the patient sits at a 90-degree angle. So you're going to be looking at like the head of the cot, like this. Here's the head here. So that's going to be a semi-Fowler's position. A high Fowler's position, in case you don't remember math, 90-degree angle, there's your 90-degree angle. Sitting straight up is a high Fowler position. Breaking terms apart. You can use knowledge of the meaning of parts to decipher the meaning of a term. When trying to define a term, begin with a suffix and work backwards. If the term also contains a prefix, define the suffix, then the prefix, and then the word root. So here are some examples. All right. Nephropathy. Nephropathy. So you have the pathy. So remember, we're going to start with a suffix here, okay? Pathy means disease, all right? The O here is your combining form. It's just to put the two words together to make you be able to say it easily. Neph means kidney, okay? So nephropathy, when you combine all those together, means disease of the kidney. All right, here you have dysuria. So dysuria. The ia means condition of. Dys means difficult, painful, or abnormal. And ur means urine. So together, dysuria is painful urination, pain when urinating. Hyperemesis. So hyperemesis. Hyper, the prefix meaning excessive. Emesis is the word root meaning vomiting. So hyperemesis means excessive vomiting. And analgesic. Analgesic. So the ic is the suffix meaning pertaining to. An is the prefix meaning without or absence of. And algis is the word root meaning pain. Analgesics is pertaining to no pain. So let's see if you're sticking with me here. I'm going to write a word at the bottom here. And if you're still with me, if you're actually utilizing this, I want you to find out what this word means and text it to me. Okay? Text me what this word means for a bonus. just because I like to doodle. I like to doodle. Okay, so there you go. Now, abbreviations, acronyms, and symbols. Medical abbreviations, acronyms, and symbols are a type of shorthand used for communication. These were developed because one could communicate faster using this method. It is important not to trade speed for accuracy. Use only commonly understood acronyms and abbreviations to minimize misinterpretations and errors. The Joint Commission and the Institute for Safe Medication Practices are considered two authorities on abbreviations and provide do not use lists. When you use an abbreviation, you pronounce each letter of the abbreviation separately and distinctly. For the acronym EMT, you say EMT. When you use an acronym, you are shortening several words, usually using the first letter of each word to make the acronym. Acronyms can be pronounced as their own word, such as sample history is pronounced like the word sample, S-A-M-P-L-E. By reading the letters one by one, EMS is pronounced EMS, or by a combination of the two, such as DCAP, sorry for that, dash BTLS is pronounced DCAP BTLS. Misunderstanding and errors occur if someone involved in patient care does not understand the meaning of abbreviations or acronyms. For this reason, some agencies limit the use of abbreviations. Abbreviations take the place of words to shorten notes or documentation. Remember to use only standard accepted abbreviations to avoid confusion and errors. If you're the only one that knows what this means, then it's useless. You're not helping anybody. Be familiar with accepted use of abbreviations in your local jurisdiction and service area. Symbols, like abbreviations, symbols are sometimes used as a shortcut in communication and documentation. As with abbreviations, it is important to only use symbols that are widely understood and accepted. Master tables and the tables in the chapter provide a thorough reference list of common word roots, combining forms, prefixes, suffixes, and abbreviations. All right, guys. That is going to be it for chapter 5. So, if you've watched this and you have stuck this out with me, I appreciate you. These lectures are going to be very useful to you for studying and for making it through this course. Again, if you have any questions or if there's any part of this you don't understand, reach out to us and let us know.